morning. It is 8 o'clock, and we're going to call to order the March meeting of the Douglas County Board of Health. I'd like to note for the public that over on the north wall is a copy of the Open Meetings Act. I do have in front of me the official notice of publication for the meeting. Let me know for the public in these times, there may be more attention to the meeting today than in the past. We are trying to be an example and practice social distancing here and adhere to the 10-person guidance. Members of staff and other members of the board are located within the rooms of the chamber. And so with that, I'd like to ask for roll call.
Chris?
Here.
Jeannie? Here. Ben? Here. Marty? Here. Kiana? Here. And Kurt's in the back.
Item 2 is approval of the minutes. Is there a motion? There's a motion. Is there a second? Roll call.
Okay, Chris?
Yes.
Jeannie? Yes. Ben? Yes. Marty? Yes. Kiana? Yes.
Item 3 are action items for approval, items A through H. Is there a motion by the board to approve those items?
So moved.
There's a motion. Is there a second? Second. Motion a second. Roll call.
Chris?
Yes.
Jeannie? Yes. Ben?
Yes.
Marty?
Yes.
Kiana?
Yes.
Item 4 is public comments. Obviously today, because of the virus and other situations in the environment today, there's no public comment. With that, we'll go to item 5 and the update on the COVID-19 virus. Dr. Poore. Let me say, Dr. Poore, before you get up, I want to, it's been said once before, and I want to make sure they hear it, for the public to know the efforts that you all have been putting in over the last 2 weeks. I want to make sure the staff knows that we appreciate it, the efforts that they're going through, and don't you know that, you know, the work you all are doing are saving a lot of lives potentially. Thank you.
Thank you all, and good morning, board members. And yes, these are unusual times, but I am so proud how everybody in this community is really working together, from elected officials to the community to business owners and so on. We are in this together. I think what the role of public health is in the beginning, especially to identify these new cases that are being brought, most of them brought into our community. So I just want to give you kind of a higher level summary. The first case in Douglas County was really not reported until March 6th. March 6th, that's 10 days ago, and that's when the governor had a news conference, and it was of an individual that had traveled back from England. We heard the story many times. Unfortunately, the individual is still in the biocontainment unit and is still in stable, critical but stable conditions. But since then, a lot of things have developed. We had a news conference right after the governor had the news conference to really let people in Douglas County know, which is a little bit our community, and I wanted to share that with our community. But just to tell you, up to last night, I did a very quick count. We have had 8 travelers, meaning these are people from the outside that have traveled to communities with high spread of the disease. Then we had 8 household contacts. That's really epidemiology, and you see how infectious this virus is. The most at risk are those who are in close contact, and by close contact we say 10 minutes closer than 6 foot in distance. So we have 8 household contacts. We have 2 contacts to contacts. That means we identified an individual, and they were not household contacts, but they were in close contact with another individual. And we have 1 community-acquired case, and as I have talked about it a lot, this is a case that we first thought it was travel-related. This individual had traveled to New York. However, The more you do these investigations and talk to individuals, you find out more about potential exposure. The first time they may not tell you everything because they may not remember. The next day they may say, oh, but I do remember, I have been here or I've been at that place. So it is really, really important, and it is an expertise that not everyone has. But I listen to our disease investigators when they do those investigations with cases on their phone, and they are developing a trust. They are developing a trust with that individual who then is going to share with them. I was at this place, I was at this place. It may be sometimes uncomfortable that people don't really want to talk about. It is so important in the beginning that we can keep that circle as small as possible. So this travel-related case went to New York. We thought, yep, that's probably where she was exposed, until she said to us, but now I remember I had the same symptoms before I went on the trip. The symptoms didn't change. As a matter of fact, they decreased a little bit. Many of us, the symptoms that she had were sore throat and a little bit of fatigue. Sore throat and the fatigue. Who would think this is COVID-19? It was only that she was tested because she had some surgery lined up, went to her healthcare provider and said, I'm not sure if it is safe for me to have that surgery, as anybody should do at that time. And the physician said, well, you may have the flu. We test you for influenza. That's what healthcare providers do. We have more than 6,400 cases of influenza in this county alone. So it is very appropriate. The symptoms are really overlapping. It's appropriate for healthcare providers to test for influenza. It's a quick test. They have results back, usually within an hour. Then the person was negative on that. The physician said, let's do an RPP, respiratory viral panel. She was negative on that too. Only after those two diseases were outlawed did he actually say, well, let's do a COVID-19. Who would have thought about it? It was a real alert physician who said, this needs to be tested, and she was positive. So she was our first community-acquired case. Even at that time, we wanted to really be sure and prudent before we were going to announce it. So after discussion with the state epidemiologist and Dr. Anton, who's the chief medical officer, we were on the call with him discussing this case. We decided we were going to do one more step and have the sample tested one more time. It came back positive again. Once it became back positive, in the next 2 hours, we had a news conference because this needs to go quickly. We need to keep the community informed as quick as we can, but we need to have complete information. We do not want to act on information that potentially could change. So that's what we have been doing. We have right now, and it goes on every day, we get these results in, some of them depending on if they come from Nebraska Medicine or if they come from Nebraska Public Health Laboratory. They come in either at 3 or 4 o'clock in the afternoon, or they come in the middle of the night. They come in the afternoon, late in the afternoon. Sometimes we do not have time to call the individual that is positive. Usually the healthcare provider calls the individual directly. That's how it should go. It should be your doc who is telling you, I'm sorry, I have to give you some bad news. You are COVID-19 positive. Because that's not a good call to make. And I think, again, that trusted relationship, we want to keep that. Yesterday, late afternoon and overnight, we have 4 additional cases that I cannot tell you any information about it yet. There need to be phone calls. These phone calls sometimes go more than an hour. The individuals know that they are positive. They are home isolating at this time. I want to share with the board that most of the cases that we have had are mild. And most of the cases that we have had are less than, There are a few cases in the 50s. There is only one case, 69 years old. All the others are in the prime of their life. Most of them traveled, came back, are in the profession. We have had some healthcare providers and healthcare workers that have come back from a trip, and you may have seen the article in the Omaha World Herald today of a physician who actually said very openly, take this serious. And again, take this serious because it affects the elderly and those with underlying diseases, which could be at any age group. It could be the child who has an immunocompromised system. It could be an older person who has underlying illnesses. So that's the status of the samples. I want to share with the board a little bit about the operations at the health department that are really kind of four prongs I would want to share over the last 2 weeks. Epidemiology, as I have just shared with you, they are really the ones who are receiving reports from the laboratory. They also are approving reports. At this time, it is still that the healthcare provider communicates with public health to say, is it appropriate to have that individual tested? And if the testing goes through Nebraska Public Health Lab, we now have a few private labs. We have ARAP, LabQuest, LabCore on site, and we know we can testing for those tests. The approval from public health is not necessary. But when the tests come in through the electronic system, we now need somebody to look at that system and says, okay, there is a positive, we need to contact that positive. So testing is loosening up a little bit. I want to share that. But by no means is testing available for everyone. That just is not the case. We are trying to test those that are at highest risk at this time, which means if you are asymptomatic or have mild symptoms, you may not get tested. And there's a lot of discussion going on if you have a link to a contact or if you have traveled and you come back with symptoms, should you not even be necessary to be tested, but you should just self-quarantine yourself. Those are the discussions because we have limited amount of lab tests at our Nebraska Public Health Lab, at Nebraska Medicine, and even in these private labs because they crashed on Monday because they were overwhelmed with the number of tests. So testing is also, I want to share with you and the public, testing is not a panacea. You can be tested today and you are negative. And so you think you are negative, I'm going to go around. 2 days later, you can be positive. For you to be assured that you don't have COVID-19, there would have to be ongoing testing. So really also the EMS worker, police, sheriff, they really would like to be tested. That is not feasible at this time. We need to preserve the tests for those at high risk at this time. This is nationwide. This is not Douglas County. This is the protocol that is being held nationwide. So the activities that are going, I can just share with you, contacts and epidemiology, there are more than 600 contacts. And that means that are individuals that are asked to be quarantined or isolated at home. And they need to take their temperature twice a day. They need to look for symptoms. And it is when they have symptoms that they then call the health department because they are potential PUIs, person under investigation who should be tested. The other operation that is going on is our info line. I've talked to you, there are 10 lines. There are 3 Spanish lines that we have at the health department. We have the line from 8:30 to 4 o'clock. We now have an agreement with 211 who then takes the call after that time. And we received Monday and yesterday more than 350 calls a day. These are calls that are not just what is COVID anymore, because there's a lot of information, basic information around there. This is really, I have traveled, should I be concerned, what are your recommendations, what about this rule of 10 or 50 or so on. So it really needs some trained personnel. We have Q&A that we adjust every day to have the newest information in there. So this is what that group is doing. Then communication in general. We have internal communication that is important, and we have external communication. Phil Rooney is doing a really good job. He's combining with Leah Bass, who is the PIO for the county, as well as Carrie Murphy, who is the PIO of the city, and Leah at the state, who is the PIO for State Health and Human Services, as well as the PIO of the governor's office. It's all of them working together, because the worst thing we can do is having messages that do not align. So really having a consistent voice, I really think these people are working well together. The other thing we have done on Monday, the state has released the state SNS, which has equipment in there. State National Stockpile, SNS is standing for that, has mainly PPE in that. And that was delivered to our warehouse in Douglas County, the Douglas County warehouse. We are what we call a hub for these type of deliveries and distributions. So being the hub, that means that Sarpy County as well as Three Rivers Health Department, they could come to our hub, pick up their allotment, and it's all by allotment depending on the population, and then we were able to distribute some of it internally to our service department who provide direct services, the long-term health center, the corrections. Mainly what was in, and the rest, probably 80%, was for healthcare providers. This went to the Healthcare Coalition. We have a Healthcare Coalition in Omaha that really works with all of the hospitals, clinic, long-term care facility, emergency medical services to really distribute it to all of them. What was mainly found in the stockpile were masks, N95 masks that required test fitting. That was mainly for healthcare provider. N95 masks that were non-fitted, but N95 masks, I think we just need to be aware, are very uncomfortable to wear. So that is not a regular mask we want everyone to wear. This is really for healthcare, those that have close contact with individuals. And the main thing was surgical masks in there too. Surgical masks are the masks that you see people walking around with, and the recommendation from CDC is that those masks should be worn by people who are sick. So people who are self-isolating at home in a household, and they should probably wear those masks if they are with their entire household, so that they are not spreading the droplets, because that's really what we are concerned about, is droplet spread. So that's our SNS delivery. There is some talk about from the feds that the state is receiving a new shipment of SNS, so potentially there is a supply of some of these, because what we hear from our healthcare providers specifically, they need masks, but they need gowns. I need gloves. There are a lot of requests for gloves at this time. They need face shields, which for healthcare providers, they have those face shields that can be used. That's going forward. We had several meetings locally with elected officials, but also through Marion Borgeson and Commissioner Rogers, we were able to have a meeting with all the mayors in the smaller communities, Bennington Valley, around the city of Omaha on Monday night. And this brings me probably to the next step. Well, I can share a little bit more too. But they really were the ones who were, I would say, the impetus for us to really say, we need some leadership. We need somebody who is not using words like recommended. We need to know what we need to do. We want our enforcement agencies to have clear rules and regulation, and that's potentially why you see the order that I am proposing for your approval today, because I do have that authority, and I feel we really felt that that is what the mayors wanted. The mayor of Omaha is also supportive of that ordinance. I talked to her yesterday. At the same time, we now hear that the state is potentially, through the chief health medical officer, is also preparing an order for going statewide. I did not want, and I do not think it is appropriate for us to wait. I don't know when that order is going to come. I think the clearer and the faster we can be to our community, the better we are prepared. Let me just talk about a few other things that are going on in regards to communication. We have incident command in the health department who is meeting every day at 3 o'clock. That's for internal operations to really be communicating to each other what each other is doing. We have unified command that has now been established, which includes all the individuals who are involved in the actual incident. So that includes fire, that includes police, that includes the smaller community fire, rural fire departments. That's now starting to develop this incident structure so that, again, we have a point person in logistics, we have a point person in planning who's doing all this. So not everybody needs to do everything. So this really comes from the military, and it is organizing an incident. It really makes a big difference when you have an incident that is large and then affects many different operations and many different departments in the community. At the same time also, we have an MSAT call, which is a call with the local officials, because the elected officials, the local officials, they want to know what is going on. It is not necessary and not feasible for them to be at every news conference, but we need to keep them informed. The MSAT call, it's a call that is set up by emergency management, and it usually goes an hour, just telling them very quickly what Unified Command is doing, and there is somebody from Unified Command on that call who really keeps them informed. It's all about communication and keeping us all informed. So that's what's going on. Commissioner Rogers is on that MSAT call. I have Carol Allensworth here, who, of course, you know, is the division chief over epidemiology. And so if you have any specific questions, she oversees this. She has done, I cannot say enough, tremendous work 24/7. When we drove over here, we are concerned about our staff. We now really need to start thinking there are people who are sick. We have been walking around and looking at distancing our employees. We need to take care of our internal employees. That's on our mind for today, that's really where we need to go. So any specific questions you have as board members, I apologize to you all board members if I was not as quick enough to keep you informed. I tried to do my best, but sometimes I think it was on the moment. There are not enough hours in the day at this time. So if you can give me a few extra hours to my calendar, that would be perfect.
Any questions? Jenny?
First of all, thank you for all the staff that have been putting in the extra hours, et cetera. So kind of going off of that, how are your staff doing in regards to overtime? Are there adjustments that need to be made in the budget, et cetera, just so that you and your staff can make sure to operate as well as you need to?
That's a really good question. And, you know, potentially in February, when we started the information line, that's when we started to think about overtime, comp time, all of this. And I can tell you in the first week when we had the information line open, and that was in February, our cost was more than $15,000, just salary, just overtime. That was not budgeted. Because what is happening now is we are taking staff who used to work on grants. They are not working on grants anymore, so we are not charging the grant, but we are charging now to a special account. There is an appropriation request that has gone into the state senators, and we'll hear about that request in the next few days, because the way we operate, everybody else operates. We do not have a fund, a slush fund, so to say. So these are very, very important times. We are going to be very generous with the staff, so they can choose comp time or overtime, so to say. We also are very generous with individuals if they want to work and can work from home. That this is now what we are going to put in place. The county has put some policies forward through the Civil Service Commission that will allow those and will allow actually some paid administrative leave for those who have been asked to be in isolation or quarantine at home. So yes, funding is an issue. We have developed the other issue is that we really need to keep track of our expenditures. So through Tim Kelso, we have developed a code that people need to code in and so on. But we try to have 2 to 3 person deep, so if one cannot be there and we can rotate and give a person off, that's really what we are looking at now. So thank you for your concern. Your concern is our concern. The expenditures of this is going to be it is going to be really large. And I have operations who potentially are not going to be operating anymore. So I do have staff who potentially wants to be reassigned to things that they can work on. As you know, we are preparing for accreditation, and fortunately, a lot of that work is looking for documentation, developing documentation, so that can be, hopefully some of it can be done at home or at work for those who used to be direct service. So we are looking at all those options. I've asked Vital Statistics, who is in this building, to close starting tomorrow. So today they have a sign on the door. It's all going to be by mail. That works. We cannot have any walk-ins anymore at this time. I have the way people are set up down there is pretty good, because they all said, but some of them may want to work from home. We are looking at that option because we had actually an individual who used to do that, and so potentially we are using the same process at that. Not all of it, because the mail is going to come in, and so we need to have people there who do death and birth, specifically death certificates. So we are in contact with the funeral directors to how this would work with them, but the whole operation can go through mail.
Dr. Poore, you want to walk through? Let me set the stage for this, because I just want you to. We had that meeting, and I was on a call last night with members of one of the community's most respected institutions, and some of them were talking in the mindset of they were going to continue business as usual. And I tried to explain to them that this needs to be taken seriously, knowing the hardships that their institution may be under. And I kind of explained to them what was going on today. Can you just walk through a little bit of the order? Because reading through it, one of the questions that was posed was this enforcement of size of 10, and it looks like through the order. And I knowing a little bit of it coming down, I reiterated to them, you can continue as operated, but no more than 10 people can be in a room. So if you want to have people upstairs, downstairs, within spatial limits, that's fine. They kind of felt like it was the government impeding on the institution's will, and my point was no. The institution is not above the law, and at this point, you cannot take this serious enough, because the institution's members are in the very vulnerable age. And so if you can just walk through some of the specifics and just reiterate again, I think the need to break this curve, because one of the points that's come to me from different realms, and you've noted at different venues, but you said specifically today, is the stress that's on the healthcare institutions. And if this number gets to a certain peak, these dilemmas that are happening in New York about concern about healthcare facility and space are not foreign to Omaha. And Douglas County. So if you can walk through the order a little bit, I appreciate it.
Sure. So under the rules and regulation for the prevention of spread of communicable illness or poisonings, the health department or the health director actually has the authority to implement an order. And after talking to our county attorney 2 nights ago, we felt that we had the authority under this order, and we're therefore going to go forward with the order. The order is, as the CDC and the President's recommendations were, it is that all public gatherings within Douglas County should be of not more than 10 individuals. So not more than 10 individuals. So we are getting these questions quite a bit. There are exceptions to that. Multiple separate rooms, and this goes a little bit what Commissioner Rogers is saying. For example, we get a lot of calls now yesterday from daycares. They say, well, does this mean the entire daycare cannot be more than 10 children? And it spells it out in here. Daycare and childcare facility must operate under the following rules. A childcare must be carried out in a stable group of 10 or fewer children. And stable means that the same 10 or fewer are in the same group each day. So you do not want to have a lot of mixing. Children shall not change from one group to another, and that has to do again. And if more than one group of children is cared for at one facility, each group shall be in a separate room. So you can have rooms, but in that, and usually daycare centers have special rooms by age group. So in that room, you cannot have more than 10 children. We clarified that with the governor, because the last thing I would want, even so it may happen, is I do not really want to be in conflict with any rules. So the governor's understanding is that there could be staff in there, but not more than 10 children. There are exceptions in there: courts of law, medical providers, public utilities, critical county and city operations, some continuity of business operations, congregated living settings, shelters, public transportation, airport travel. We get a lot of questions around there. Necessary shopping at fuel stations would be exempt. Stores or malls would be exempt, or to family residences housing 10 or more people. So it is pretty clear that private institutions, this all, it's not about finding loopholes. It's having common sense. So don't try. I would encourage everyone in the community not to play with words, but take it what it says. You should not have more than 10 people in a room, because it's all about social distancing, and the data is so clear. The data is clear in our 19 cases. You sit next to an individual on an airplane, and we had this happen, you did not know that she's going to be COVID-19 positive. But you sat next to her, you are getting a phone call from us because the quarantine office in Minneapolis will inform us about the people who sit 2 or 3 rows in front of the individual who has been identified and 2 to 3 rows behind. We have had a positive who sat in that range. So it's not about trying to find, is it 9, is it 10? It's about keeping distance. It's about look at you in this room. Look at this room in here. It's about keeping distance. So if I cough, my droplets are not going to land on your hands. They are not going to land in your breathing space. And then you put your hands in your face. I don't see anybody putting their hands. I heard a good analogy, and I think we should take it to heart. Every one of us should think we are infected. And if we walk around that way, by themselves, we are going to keep that distance. We don't want you to infect, don't want to infect anybody else. So start to think about having that range around you. I know this is hard, but if we hear about the illnesses and the deaths that are occurring in Washington state, I think I have no objections from anyone. We want to prevent that from happening. We want to preserve our older population and the population that has underlying illnesses, which could be at all age ranges. So I would say to everyone, be you an institution or so on, try to follow these rules. Don't think you are special, because you are not. The virus doesn't identify where you are in a public space or in a private space. That doesn't. The virus is tiny. It's tiny. It's 1/900th of a hair. And it hits a right, actually, on your sputum and on your cough droplets. It's there. It's usually now what we are hearing. The symptoms are usually upper respiratory in the beginning, and that's when the samples are usually positive. We hear now, as time goes on, symptoms are in the lower respiratory tract. That also means that sometimes the test results can actually come back negative. So what I would encourage everybody, take this serious to prevent our high-risk population. That's what we should do. That's, if we do this, we try to keep it as long as we can. Keep it out of our long-term care facilities. Keep it out of from our grandmas who are sitting at home. Keep it out of the high-risk population.
Thank you, Dr. Poore. Any other questions on this? Janie?
Two questions. One, I'm seeing the date that for the order is March 18th to April 3rd, or 30th, sorry, April 30th. So I'm assuming schools will likely be out at least through the end of April.
Correct. That's already the order from the governor too, that this is a school is out potentially 6 weeks. This will be evaluated. I definitely do not see the tip of the curve. As long as the curve goes up, this is going to be in effect, and we will reevaluate. And if the order needs to be changed as we move along, we will change the order.
Okay. And then my second question goes to, with your unified command group that's meeting regularly, some other states have activated their National Guards. Is the Nebraska National Guard sitting in on those conversations? And I understand it may be very, very early at that point in time for those services, but what types of services would they be activated for?
I don't think the National Guard is in those unified command calls, but the National Guard actually has already been very much informed and engaged in this community, because remember the 59 individuals who came from the cruise ship. They actually went to Camp Ashland, and it was Camp Ashland is the National Guard camp, and it was through them, through the National Guard, who actually provided quarantine for those individuals there. So they have been very much informed and engaged in this process. I tell you, this isn't going to get any better. So the next thing that potentially the governor and I had talked about as a sidebar already, we need to start thinking about places where people can quarantine who cannot quarantine at home. We need to think places where people can isolate. They may not be ill enough to be at the hospital. So he is in constant contact with the National Guard on that. Could that be asked again? So those are the things that we would ask of the National Guard and of some of the other organizations. Are there facilities that could be made available if needed?
Anyone else? All right, any more? Is Carol coming up now?
Well, only if you have any specific
Oh,
questions.
okay.
Do you have any questions for her? She'll be more than happy to come up here.
I just want to thank everybody in this community, whether it be the Board of Health, whether it be all of our community partners, our businesses, everybody that we're working with, for them to work with us on getting these interventions put into place so that we can protect the health of our community. So I just want to thank you all for your input, your support, any guidance you're giving to us. So it's just a thank you and a thank you to my staff, our staff of the health department.
And Carol, I want to thank you too. I know when we came in there Sunday, you had already been there for a good period of time, so I know it's wearing. But thank all of you for your efforts. Appreciate it.
Thank you.
And all the health staff in the accounting rooms around who came outside of rows for the good of the community. With that, we have no presentations. Note that on item 7, the usual presentations that we would have had in conversation with Dr. Poore, we figured this would be a good time to pivot because of some of the length. So from now on, what we'll be doing is that you have a report from each of those directors, and before the meeting, it's like a 1-2 pager that you can scan, and instead of going through it in detail at the meeting, we'll just go directly into questions you may have on their reports in the future meetings so we can get to that. So with that, we kept the meeting intentionally short today to give Dr. Poore and her staff time to get back to the work, but we do have need for an executive session on one matter. And so with that, we do need to go into executive session. So I'd like to ask for a motion to go into executive session for personnel reasons.
An executive session for the discussion of personnel.
There's a motion, there's a second.
Second.
And again, we're going into executive session for personnel. Roll call.
Chris?
Yes.
Jeannie?
Yes.
Ben?
Yes.
Marty?
Yes.
Kiana?
Yes.
Okay, for those of you that know, we just go back in this room right here. So, for those new on the board, this used to be the So we need a motion to reconvene and adjourn.
Only discuss personnel.
And adjourn.
Second?
Roll call. Yes.
Jeannie,
Yes.
Ben,
Yes.
Marty,
Yes.
Kiana.
Yes.
Motion adjourned.
You-
No, we did it all in the same.
That
we
that
did
was
it
all
in the same
together.
one.
yeah.
Okay. All right.
You may
We
leave
good.
now
So, wait,
until our next